Dr. Willis, thank you so much for joining us here on Health Connection. It's a real pleasure. Our topic is dementia, seeing it before the signs. We're going to try to see dementia before we begin to experience the symptoms. In March 2016, right now, scientists at the University of California at Berkeley published a research paper showing that positron emission tomography, a PET scan, can actually track the progressive stages of Alzheimer's disease. That sounds like extremely significant research. Talk about that a little bit.
Well, it is significant. Alzheimer's disease historically could only be diagnosed accurately at autopsy. So for the first time, we're discovering an imaging technique that may be able to image while the patient is alive and find these structural brain abnormalities. We hope that this is an open doorway to using PET scans for early diagnosis and staging of Alzheimer's disease.
Well, in simple terms, what is the PET scan seeing that we haven't been able to see before?
Well, one of the abnormalities in Alzheimer's disease is known as a plaque. It's an abnormal protein accumulation in certain parts of the brain. Researchers have designed a drug that has some radiation attached to it. When that drug is injected in the vein of the arm, it travels through the bloodstream into the brain and it accumulates in these protein plaques. A special imaging camera is then able to detect these areas of radiation and create an image of the brain that allows radiologists to not only identify where abnormalities are, but perhaps even the severity of the abnormality. We hope that this will allow us to find these abnormalities at an early stage when they can be treated, and obviously without having to go on to autopsy to discover what this disease was.
Well, now, as I understand it, this diagnostic tool is not yet available in the clinical setting, but if the research proves to be as valuable as it sounds like it will be, what will it mean for the future of diagnosing and treating Alzheimer's and other forms of dementia?
Well, first we hope that this kind of brain imaging will serve as a biomarker that allows us to identify and diagnose Alzheimer's disease. Second, as new therapies and drugs are created to treat Alzheimer's, we hope that we can detect Alzheimer's disease at an early stage with these brain imaging techniques and to be able to monitor the effectiveness of these therapies.
Based on what you know about this research, how far away is it from clinical use?
I think they're probably in stage 2 or 3 of trials, and they are encouraged by their accuracy, so we may start seeing this perhaps in the next year or 2.
Wow, that soon. Interesting. UT Health Northeast here has approached the diagnosis of dementia from a different direction. I'm going to read this. You're using magnetic resonance imaging, or an MRI, and high-tech brain image diagnosis software. Tell us about it. What is it, and how does it work?
Well, it's been known for a long time that rapid shrinkage of the brain is associated with some forms of dementia. Researchers have been looking for an imaging method that would identify these areas of shrinkage while the patient is alive to make a diagnosis. MRI provides exquisite images of the brain that may serve that exact purpose. In researching and measuring these areas of shrinkage, it was quickly learned that to manually do this was too time intensive and expensive for so many patients that needed it. This led to the creation and discovery of an automated software that would do the process for us, and that's known as Neuro Quant.
How does Neuro Quant work?
Neuro Quant is a software program that works in conjunction with standardized MRI techniques. A dedicated computer receives the brain scan images, analyzes and measures the volumes of these critical memory centers in the brain. Those volumes are then compared to the brain scans of normal, healthy volunteers. This allows us to detect areas and patterns of shrinkage that help physicians then diagnose and maybe more specifically characterize the type of dementia that we're dealing with.
Okay, so describe the type of patients that primary care physicians are referring to you for this advanced MRI.
Typical patients that we've seen are usually about 70 years of age or older. They've been suffering with mild to moderate memory difficulties for several years, and they seem to have several risk factors for various types of dementia.
Okay. What information are you able to report to the referring physician to share with the patient and the family members?
Well, NeuroQuant describes the volumes of the shrinkage areas in the brain. It compares them to normal, healthy volunteers, and it creates a percentile that tells us what percentage of people have a larger brain or a smaller brain than the patient that we're imaging. If these reach critical values of volume, in other words, if the brain becomes too small, then we're able to try to characterize specifically what kind of dementia this may be involving.
Okay. Alzheimer's and other dementias cannot be prevented, they can't be cured, can't be slowed. So what are the benefits of being screened by an MRI and the Neuro Quant software?
Well, first of all, this is not designed for screening in asymptomatic patients or in those that just have a curiosity because maybe they've got a family member that has Alzheimer's disease. But what we do hope is that first we are able to, for the first time, identify abnormalities before the patient dies and determine that they may have some kind of dementia. Second, we hope that this kind of brain imaging allows us to monitor therapies and get people into early treatment or to monitor the effectiveness of the drug therapies that are being created.
We just mentioned physician referral for this. Is that necessary in order to be tested here at UT Health Northeast?
Yes, it is. If your physician feels like you've got symptoms that warrant this kind of testing, they can contact us by phone or fax in the radiology department at UT Health Northeast. This information is also available on our website, uthealth.org.
Very well. This MRI enhanced brain image, is it approved by the FDA and is it covered by insurance?
FDA has approved this technique for clinical use. And we are finding that if you have symptoms that warrant this kind of testing, that Medicare is paying for this service. We've also found that many insurance carriers, including supplemental Medicare insurance carriers, are paying for the test.
Very well. Doctor, thank you very much for your time.
Thank you.